Our last session today is measuring well-being and wellness, which I know is a topic that's near and dear to all of our hearts. But pleasure to introduce Dana Tasson, who's the Executive Director of Student Health and Counseling, Portland State University. Welcome.
Thanks, Devin. Welcome, everyone, and thanks for being here. I am Dana Tasson. I'm the Executive Director at Portland State for our Integrated Health and Counseling, and also a board member at large for your ACHA board. We have a great panel here today, and they are going to introduce themselves, say a bit about their background and where they are.
Sure. Hi, I'm Michelle Burcin. My current role is an academic program director for a fully online MPH program at Walden University. In my previous life, I worked at the University of South Carolina for many years, heading up their Healthy Carolina initiative.
My name is Nicole Brocato. I'm the director of the Wellbeing Assessment Project at Wake Forest University. I'm a psychologist by training with a mixed background in clinical and psychometrics.
Wonderful. Good afternoon, everyone. My name is Robert Reason. I'm a professor of education, higher education and student affairs at Iowa State University. And I think I was invited because I used to be the director of the Research Institute for Studies in Education at Iowa State, and we run something called the Personal and Social Responsibility Inventory and have done some work around wellness using Corey Keyes and his instrument. So that's my background.
Okay, thank you, panel, for being here. Today we're going to touch on the measurement of the various aspects of well-being that we may have covered today. A disclaimer, my illustrious panel members have said that each one of these questions could potentially be a semester-long class, and none of us want that. So they're going to do their best to kind of hit the highlights for us, especially touching on ways we might measure some of these aspects of wellness, the differences that those measurements might lead to, and also how we might do it for those of us who don't have extensive budgets to do this kind of work, but still want to employ best practices. So with that, I'm going to go on to the first question, and this is the easiest one, I think. Given the aspects of well-being that we have discussed in prior panels, what measurement challenges do we face?
Well, I think I'm going to take a stab at this one first. I think one of our measurement challenges brings us back to where we started at the beginning of all our discussions, which is continuing to think about what are our theories about what well-being is, and what are the models that we're building on those theories. There's, as Jenny said yesterday, there's 2 millennia of people who have been thinking and writing and researching about this. So we have almost an overwhelming amount of information to draw on. So as we are trying to get better at defining concrete and specific and actionable models for our well-being, programs that are specific to the unique needs and cultures and interests and capacities of our campuses, one of the things that's starting to happen is we're getting lots of models that sound sort of the same, but then they're defined slightly differently, and I think it's making a little bit of a measurement challenge. So if I measure meaning one way and you measure it something else, can we compare those things? I'm not exactly sure. And I wonder sometimes as well if in our efforts to make our models very specific and concrete, we might be overly narrowly defining meaning sometimes by confusing pathways to meaning with outcomes, or pathways to well-being with outcomes for well-being. So outcomes being big strokes things that we all care about for the sake of themselves, meaning, purpose, belonging, pathways to well-being being the things that get us there. So in the context of meaning, that might be, and I'm going to pick on meditation a little bit because it's also been around for 2,000 years and I think it can take it. But meditating to gain the kind of self-compassion and clarity you need to do the self-reflection that will help you define the goals and create the value systems that create a sense of meaning and purpose. But if we mix up our pathways and outcomes and say instead actually well-being is meditation and self-reflection, we run the risk of alienating students for whom meditation isn't appropriate, or students who are depressed and are already ruminating. So there, I think, are conceptualizations perhaps of well-being that focus, so all this is coming from the engine model of well-being, which is a paper written by Aranda Jayawikrama, who's faculty at Wake, Marie Forgiard, whose name I think I just mangled, and Martin Seligman, and they published this in 2012. And basically this model says, in our models of well-being, we need to be focusing on big picture outcomes and keep those things distinct from the pathways that get us to well-being so that we don't overly define or exclude people from our models of well-being.
And how would we go about measuring those pathways so it's not confused with the outcomes?
So I don't know how to say this without sounding like an advertisement. In the well-being assessment, we are attempting to do that. We've got items that we treat as indicators, for instance, of whether we have meaning, people have meaning, and we've got items that ask, do you have a value set? Do you have people in your life you can talk to? Are you using this range of skills that would maybe help you develop a sense of meaning in life? But I don't think necessarily in the spirit of diversity and inclusion and equity, that the well-being assessment or necessarily the engine model are the answers for all campuses. I'm saying something more along the lines of they are an option for making sure that we keep these things separate from each other.
So if I go back to the first question and talk about one of the challenges I'd highlight, just for transparency's sake, I come at most of my work from a social psych kind of perspective, trying to balance kind of understanding the individual within a context. And so you'll hear me say multiple times today, it depends on the context. And so Nicole talked about models and theories, and I'm going to suggest then the next step, and which then creates the next challenge, is how do you operationalize what you mean by wellness, which I think is also what Nicole was saying. So what does wellness mean? What does well-being mean on your campus? And then how do you create a set of items, if that's what you're going to do, that assesses well-being in that way? Because again, well-being at any of our campuses may be operationalized differently. And so we got a challenge of operationalizing within the context of your individual campus, which then raises all sorts of other issues about transferability and generalizability and those kinds of things, if you care about those things. Now, the other thing is, I'm going to suggest a couple of times, maybe we don't have to care about those things so much, as long as we understand it within the context of our campuses, our individual campuses, and the work we're trying to do. The other thing I would say is remembering to think about well-being as a construct made up of lots of different things. So we're not going to find an item, or I would suggest we're probably not going to find a single set of items that comprehensively assesses or measures what we mean by well-being. And so we're going to look at multiple surveys, multiple sets of items, multiple observations that would get to some better understanding of well-being and our effect on well-being, the effects of our programs on well-being and the improving well-being in the students we're serving. So operationalization as a struggle or as a challenge, as well as thinking about it as a construct.
Michelle, did you have anything to say about the challenges you
Sure.
faced in your work?
Sure. So I come from a student affairs perspective, and so I attended many American College Health Association conferences and would come back to my office and be like, I can't do that. I don't have the bandwidth, person power, I don't have the financials or whatever. And I think it's really important to take away that there is a lot of data on your campus already, and you don't necessarily need a giant NIH grant or gazillions of dollars to get your hands on good data. And the important thing is doing something with that data. Often we're inundated with data and then we don't do anything with it, so having it's not very helpful. But thinking about your partners across the campus, be it in housing or police department or campus recreation, the utilization of your health center, your electronic medical record, your utilization in the career services, counseling center, looking at all your partners and what data they're collecting, and maybe you develop an instrument out of all these different measures all across your campus because you don't have the ability to customize an instrument and deliver it. And so just coming about it from a perspective of doing something is better than saying I can't do anything. And there isn't perfect data. You're never going to have perfect data, even if you create the instrument. And I think the other thing to think about is it doesn't always have to be paper to pencil, self-reported data. It can be observational-based data. It can be qualitative-based data where you're doing key informant interviews. You guys have key leaders on your campus. Use them. Have one-on-one conversations with them. Take them to lunch. Go to sorority fraternity council. Go to your student athlete advisory council, making sure that you have good connections with those leaders on campus, and do those key informant interviews, focus groups where you can gather really, really good, rich data that may help tell the story of the numbers that you're getting.
So this question might dovetail nicely with that, because we know we can spend anything from nothing to $10 million over 4 years on kinds of assessment. Given that most of us don't have that kind of budget, how can we tell what's good enough for our purposes?
Yeah, so I'll jump on that one real fast. I think that's hard because the researcher in my brain's like, well, it's got to be good research practices or the data's not valid. But I think it's also having some information. Your electronic medical record is a great resource to pull aggregate data. There is a wealth of data on your campus, and having access to it. Yesterday in a session, I thought someone had picked my brain because I had just been writing it down about having it an item on your course evaluations. I think that's brilliant. If your university mission has health, well-being, or wellness in it, that has opened the door, in my opinion, for you to have that conversation with the academic side of the house to say, our university mission talks about health and well-being. We need to put that into the classroom. And so can we please add an item onto this? And as someone said yesterday, that'll get the fastest attention of your faculty members, which are an untapped, in my opinion, untapped resource on your campus. When I was in student affairs, I'm getting off on a tangent a little bit here, but when I was in student affairs, when I first started, I very much felt like the faculty member were they were in this ivory tower and they were untouchable. And I think that thought process needs to go out the window because you have carrots that they want. So the whole carrot mentality, you have access to students. You have buildings on your campus for meeting with students. You have the ability to connect with students that a faculty member may not. And so having that understanding of who your partners are on your campus that do student-based research. I know where I work, we have a product called Digital Measures, and it's where faculty load all their research interests. So if I was at a liberal arts university and I may not have a school of public health where it may be difficult to find my partner, this Digital Measures allows me to query and find out who's doing research in post-traumatic stress, because that's what I'm working on right now, or emergency preparedness. And I can query down to find my faculty partner. I think that's really important. And faculty members want access. They want to help. Letters of support for T&P, tenure and promotion, go a very long way. So I think I kind of got off on a tangent there, but it's a very much an untapped resource that can help make the data that you have more powerful, I guess, is the best way to look at it.
Anyone else want to say something about how do we tell when it's good enough? What do we need to look for?
Sure. I was thinking about this since we touched base yesterday. My mentor, when I was in my first faculty position, used to say, like weekly, research design is a series of compromises. And so we can start with the best research design humanly possible, and then knowing we have to keep backing away and keep making those compromises until we reach something that is as good as it can be and still good enough. And most of the time, as when I've been thinking about what we're talking about today in well-being, it's often about what the purpose is and what the audience is, who the audience is for the research or assessment we want to. I also want to get away from the word research, because I think what we should be talking about is assessment. Research brings with it all sorts of that baggage that Michelle was talking about when it comes to faculty and big dollar research projects, and that's probably not what most of us are able to do on our campuses. Most of what we're trying to do is assessment to figure out whether what we're doing, the interventions we're doing, the offices and our activities are positively affecting the well-being of the students. And that's an assessment question, much further away from a research question. So good enough has to change, because the purpose of what we're doing is changing, and the audience is changing. The purpose of assessing how well our intervention is working to improve well-being has an audience of the office, the students, and potentially your supervisor, who you do have to go ask money from. But that's the audience. So good enough is different than if you're trying to publish in a refereed archival journal someday. Those are two separate purposes, and so good enough our assessment of good enough needs to change because of that. So again, research design is a series of compromises. I now subject my grad students to that about once a week as well. But I think it's just a great way to remember we shoot for the best and then make the compromises that are necessary so that we can do what's important.
And I think that a lot of schools are doing a pretty good job with this, actually. I don't want us to instill any sort of anxiety that everybody has to run out and find better measures. Through the course of working on the well-being assessment, we've had lots of conversations with lots of schools who are trying to find measures that are right, both for their overall initiatives, which is a slightly different measurement question than how is my 2-hour workshop this Friday afternoon working. And I think people are already being very thoughtful about this and very intentional about this and making use of existing measures. So my impression is that folks are on the right path.
We've touched on this a bit in the beginning, but how do we take the evidence and measurement that we have and apply it effectively in regards to implementation of programming, or talking to administration about our programming, or making adjustments to our programming?
So I have to do a Healthy Campus plug. The Healthy Campus website off of ACHA has a great framework called Map It. And what it does, it walks you through the process. It takes you through having data and how you take priorities, and how you make your campus priorities, where you start with the data and how you get to doing something with that data. It could be as simple as running a gap analysis. You look at where you are, where your campus wants you to be, and you pick the one with the biggest gap and you jump in. I mean, I think making data-informed decisions is the base, right? That's where we want to start. We want to do good data-based decisions. I think, again, I'm going to go back to the academic side being an untapped resource. I find when I talk to administrators, they're overwhelmed with the data because their day-to-day life doesn't allow them to sit and have fun in SPSS and run this data, right? They're so busy seeing patients in crisis management, putting out fires. When do they have a chance just to sit back and look at the data and what they should be addressing? And that's where I think playing into some of your academic partnerships could be to your advantage. Just to give you an example, my academic program has an SPSS course where the students run SPSS data and they come out with output. They're running data that's helpful for me. Like, that's not hard. Like, here's a data set. I took all the qualifiers out. You don't need to know the people's names, but how about you answer this research question for me and your whole class gives me the answer? Or you want to know your biggest problem on campus, give them your ACHA. Take all the qualifiers out and let students do the research. You have students on your campus learning how to, or needing to learn how to take data and present it to a population or target population. Why can't they use your ACHA data? Why can't they take the data that you have, answer your research question, and do a presentation for you? They're going to do your work for you. And they're learning at the same time, and your students want to learn with real data. They don't want make-believe data sets. So that's a little off topic again, but I think it's an untapped resource. I can't say that enough as far as using your students various programs, dissertation students running data on your NACHA or whatever other instrument that you have.
And keeping with the idea that not everything has to be research quality for a top-tier journal, the analyses that we're doing to get just a basic analysis of the context of our campus or if our program made a difference, it doesn't have to be longitudinal, cross-lag, latent growth, anything. It can just be some descriptives about where people are, where they were, and the other important part of that puzzle is having some context against which to interpret your information. So if you get NACHA data back and you just look at your own school's information but don't compare it to the national rates, it can be easy to misinterpret what you're seeing. So think about what your school's missions and priorities are, focus on those particular areas, and then look at maybe your depression items and go, oh, my students are really depressed. And instead of saying, this is an emergency that's special to us, you can look at the national data and go, oh, this is an emergency that's special to everybody.
Survey fatigue. We've all had it on our campuses. We all have it. Are there ways that we can measure without doing another survey of students?
I mean, I think that goes back to using measures that are already being collected on your campus or doing qualitative-based research and not having to send, 22,000 students another survey that they're not going to respond to, or incentivizing them with a budget that maybe doesn't have the bandwidth to incentivize to get a decent response rate. Using items that are already on campus or sitting down with individuals and talking through what you're seeing, what they're seeing. And again, we've heard it over and over again, is hearing from the students, hearing from the population that we're addressing and working with and getting their voice. And so we don't always hear that voice in the quantitative data. You have to pull that qualitative. And again, you have students that are learning to be qualitative researchers on your campus. Use them, help them get real world experience.
And make good use of the data that you have across measures. So I know a lot of times we get data back that's de-identified, meaning it doesn't have student IDs or emails or other things that can help you link across the data sets. But a lot of them have enough similar items, enough similar demographic items that you can use that information to kind of ground your interpretation across the measures. So that if your measure asks about depression and my measure also asks about depression, now you don't have to ask about it because we've already asked about it a couple of times. So be working with your campus partners in all the departments to understand what data already exists and how you can interpret those sets of data with respect to each other.
And I would like to encourage you to challenge your assessment directors at your division level. So that at the Division of Student Affairs level, so that there is open dialogue between departments about what's happening. So you don't have 4 departments asking about the same thing in 4 different ways and you get 4 different answers and you don't know, it's not helpful. But challenging someone on the campus to take ownership of assessment of well-being or just assessment in general so that you can work together and housing sends out their assessment every April. Well, we're going to do the NACHA. Let's make sure we're not doing it at the same time. And can we have items in there on yours? We'll have items on ours. How can we partner on this instead of us staying in these silos, even in programming and assessment?
I have one original thought perhaps, and then just a co-signing of what Michelle just said. Not everything needs to be assessed every year.
Right.
And again, I'm actually 2 national surveys that I work with institutions on, and we recommend every 3 years. And I think even the folks at NESE are now recommending every other year, every 3 years, because nothing, we're like the big ship. Things don't change dramatically every year, so we don't have to do all 3 surveys every year. We can space them out, and I think that's important to remember. The other thing I want to co-sign what Michelle said, that using existing data, so if you're collecting from the NESE, there are items on there that begin to serve, when you look at them, they begin to serve as proxies for well-being. But because that's a secondary source of data, you're not going to have, the question's not going to be asked exactly how you would like to ask it as it relates to how you've operationalized your understanding of well-being or wellness. So you then get to follow up and ask a student. Sue yesterday from Duke during the first session said something about finding these data. One of their findings from an existing survey where reporting had gone up. And some folks were interpreting that as a good thing, and some people were saying, oh my gosh, the number of drinking behaviors, negative drinking behaviors, or the number of sexual assaults is going up, we're in trouble. And nobody knew how to interpret it. The folks who know how to interpret that are the folks who responded to the surveys, right? And so, maybe not in that particular instance, but if you're talking to somebody and if you're looking at data that somebody else collected, and it's showing an increase in certain behavior, and you don't know whether that's because awareness is up or because drinking is up, ask the folks who took the survey. They'll tell you. So don't forget to do the mixed methods. Talk to folks. Talk to your key providers who are interacting with students. And that'll help kind of make sense of the quantitative data that might have been collected for another reason. And also keep you from doing another survey.
Yeah, I think a lot of these comments have been talking about getting an overview of your campus and how your campus is doing in general. And I mentioned that that's a slightly different measurement question from evaluating how is my particular well-being program about figuring out what my values are, how that's doing. And I think you can put these pieces of information together. So a lot of these surveys, these large-scale surveys, focus, again, on what we would call outcomes, so big picture issues like meaning, purpose, and belonging. But you can use all your program evaluation and student feedback about your programs to get a sense of what's happening at the pathway level, and if some of your programs are moving your pathways, and that is what is contributing to changes or lack of changes that you're seeing in your overall outcomes over time.
So even in the presence of all these alternatives, what if you still really want to do a survey? What are some of the ways that we can get around the obstacles, mostly of survey fatigue, but what are some best practices to do that to make it the most effective if we're going to go through all that work?
Well, thinking at the campus level, you probably don't need to survey everybody on campus. And so if you're working with your IR folks or you're working with your assessment folks, to take a sample of students or staff who can take this survey, who are representative of the bigger population, and then balance that out. So the next survey goes to who's left over. Individuals aren't getting 2 surveys in succession or 3 or 4 surveys a year. They're getting 1 or 2 a year. That is sound research design. We do sampling all the time, and it's actually in certain cases better than census or population samples, because it you can get a better sense from folks who may not regularly respond, whereas if you get a census sample, you may lack, in the case of students, men don't respond very well to surveys at all. And so we get
Particularly men of color.
Right, particularly men of color. So we get a sense of the campus from a non-representative population, even though we think we've surveyed everybody. And those are important issues to keep in mind. So survey sampling is one way to avoid some of that if you're strategic about it. The other, again, is just make sure you're thinking strategically at the university or college level about the surveys that are going out in a given period of time. Probably most folks are doing that now a year in advance, thinking about, next spring we're doing the PSRI or the NESI, so we have to not do something else in the fall. And making sure that you're only asking the questions that you find actionable, which is another thing. A large multi-page survey where only the last 3 items are actionable is frustrating for all of us.
My research faculty member beat in my head, don't ask a question if you don't plan on doing something with the answer. Or if you don't want to know the answer, I think is equally important. Like, if you already know what you want the answer to be, you may not want to ask that question. So being prepared to get answers that you're not loving, or if you're not going to do something with it, don't ask it. I think that's really big.
and preparing students that the survey is coming, particularly groups that are less prone to participating. So working with the folks that run your first generation programs, getting in touch with your offices of diversity and inclusion, trying to understand how you can help these folks feel more engaged in the research and more a part of the research, so that we can get a better understanding of what's going on in the well-being assessment. We administered it to 16 schools across the country last year. We had a sample size of 6,300. There were still a couple of race by gender groups for whom I only had 2 or 3 participants in those cells. So in the interest of making sure that we're addressing this problem that well-being can be perceived as whiteness, we need to make sure that we're really sampling our students well and encouraging them to be a part of that work.
And I think on a college campus, helping the students understand the importance of the data and what you plan on doing with the data, and maybe in the past, what that data has led to as far as changes on your campus. So if it's the ACHA and you're doing this every 3 years, what has happened as a result of it? We asked about X, and as a result, we did Y. And making sure that the students know it's almost like that their voice is being heard and it equals something. And it's just not, I'm a number and it doesn't matter, but that's something could actually change if we hear from you, but we don't know what to change if we don't hear from you.
That's a great suggestion. I used to work more closely with ACT, and they would say the places where they get the best survey responses are those places that share transparently that this office is open until 8 o'clock on Wednesday nights because you told us it needed to be. Those kinds of, here's how we're using your findings from last year or the last couple of years, helps students recognize the importance of surveys. There are other strategies. We haven't talked about incentivizing responses, a raffle for everybody those work as long as they, it's meaningful and it's meaningful to your campus. I worked with a couple of institutions who raffled off to people who responded to surveys a close-up parking spot for a month, which, certain institutions in the north, that month should be January or February, and having a close-up reserved parking spot was a great incentive. So you can do certain things like that, more than like $2 or a potential for a gift card or another iPod. We used to do iPads and iPods all the time. Now everyone's got one, so that's no longer all that effective. But be thoughtful and creative when it comes to those kinds of things, and you can boost your response rates.
I would suggest that I've heard a couple of schools doing this, that data town halls are a great way both to get students involved and to do some of that qualitative work we've been talking about. So you can say to your students, here's the number that we're seeing. This doesn't make sense to us. What sense does it make to you?
And actively involving the students in your research, like good old-fashioned nominal group process. If you as a department are trying to figure out programming for the 2018-2019 calendar year, and you have them all on poster boards, and you give everyone those little dots that we used to use on medical records and ask them to vote. I mean, it sounds very archaic, but it involves the students, again, in collecting information, very different way, actually significantly cheaper and faster because you can look visually and say, oh, this is what they're interested in. Very simple, but a very quick way to get information.
Well, the parking space, definitely, I'm going to remember that. So imagine for a moment that you are the director in a smaller school, maybe with just a few people in your center, but you still want to do this work because you know it's important. Any tips for the smaller organization that might not have a lot of resources to do some of these things?
Yeah, I actually have a thought that I think is probably relevant to all of us, which is don't try to do all the things all at once. We can only, well-being, as we keep talking about, covers so much conceptual and applied territory. Focus on 1 or 2 things a year. And start there. Make all your measurement and programming evaluation work that year about belonging and engagement. And it may actually need to be more than a year because you may need to do 1 year to assess things and another year to see how your changes worked.
And I think you just hit on something that I think many of us in student affairs struggle with, and that's the pause, assess, and then do. Because we want to go. We want our keys, we want our office, and we want to hit the ground running. In that pause, in collecting data and getting a good baseline. I mean, all of us have to fight for our positions at times, right? Budgets are tight. Data's going to be your best friend in that. And that pause will give you good baseline, hopefully good data to then make your case going forward. But just taking that second just to be and figure out what you need to do before you jump in.
And I think oftentimes we find ourselves in the position of really wanting to pause, but then other forces kick in, like someone in the School of Social Work is doing, a wellness project, and do you want to be involved? And, not really, because you have other things to do, but you don't want it to happen without you either.
Right. Yeah. And I think that's the power of saying no, right? I mean, if your department has a strategic plan and you're only working in these 2 specific areas and someone contacts you about area 4, you say, I'm sorry, we just don't have the bandwidth. And that's really hard for many people to say, but for your well-being, we all need to do that.
Well, that's our list of questions. I wonder if any questions have come through from the audience.
We do have a couple questions. One is, to determine whether a rise in behavior is real or due to reporting, how about asking on the current survey if they filled out the prior survey?
And/or finding ways to create unique anonymous identifiers in the survey. And there are ways that you can do that on the back end, and there are ways that you can add questions to the survey itself, so that when you get your de-identified data back from whatever the survey is, you can look and see if people have participated in both. You can also include open-ended responses that ask people about whatever the particular behavior is. Now, you then have to take a look at those open-ended responses, which presents its own challenge, but that's also a method.
Your thoughts?
Yeah, no, spot on.
Another question was around how do you measure or evaluate the longevity of interventions that are being applied through well-being? So I guess this question is trying to get at, how do you look at well-being initiatives long-term, even post-graduation, to determine if it really endures?
So, go ahead. One of my favorite research designs or assessment designs is pre-post-post. And we often think pre-post, so if we're talking about assessing an intervention, pausing to do the baseline and doing the pre-assessment makes sense, and then doing the assessment right after they leave, or as they're leaving the door, as the session ends, the post-assessment, and then looking at the difference. That makes great sense. If we were thinking about longevity of effect, having a second post assessment, whatever time period makes sense, 6 months, next semester, the end of their academic career, is a great way to think about that. And if you get enough folks completing all 3, you have some pretty good actually research data at that point, where you can look at the effects of an intervention over time. So, and then the other thought I would put out there is that is a great research design at the individual level, but you may not need that to get continued resources from your supervisor or from your budget officer, or you may not need that to make a judgment about how effective that intervention is. You may need cohort data. So if you have a pretty steady understanding of this is where students start and those who participate in my set of programs end here, and then by the time they graduate they're still about there or they're a little better, that might be good enough. And again, I'm going back to audience and purpose as important qualifiers as when you're thinking about those kinds of designs.
Any specific ideas about what kind of data really works for administrators? Because I know people always have that on their minds. Any personal knowledge that you can bring?
So the registrar is my favorite person on campus. Anyone that I can help link back to persistence and retention. So if I'm collecting individual-based data, if I can get persistence rate to graduation and connect that back, that tells a very powerful story. it's a numbers game, really, when it comes down to it. They're thinking about the dollar, and they don't want to lose that student until they graduate. And so if we can connect it back to academics, and it could be term-to-term graduate, it could be term-to-term retention, it could be quarter or year-to-year persistence, or it could be graduation rates if your institution's struggling with graduating students. So seeing them all through the process.
Financial aid data
Yeah.
is another good source. We hear anecdotally, especially from campus rec departments all the time, that their participation rates aren't quite what they want to be because students can't afford to come and do all the things, or that some groups are more likely to participate than others because, again, of socioeconomic differences. So pulling financial aid data to see the extent to which that's true is helpful. Students themselves are not very good reporters about socioeconomic status, so either asking concrete and specific questions like, can you afford to do this, can you afford to do that, or looking at financial aid data is a good way to get at that. We also included in the Wellbeing assessment, we have an item that asks about, have you experienced socioeconomic discrimination in the past year? And we find that that is associated with all sorts of interesting outcomes, like being far less likely to report levels of belonging and engagement in activities that we would like to see.
I'll go back to know your audience. My provost at the Iowa State University of Science and Technology is an engineer, so he likes data, quantitative data. And so knowing your audience and knowing and connecting it to retention, connecting it to the financial aid is very, very important. Other folks, if I'm trying to convince other folks around budgetary issues or around continuing a project or supporting a project, it may be the student anecdote, the anecdotal story, maybe the qualitative data, could be the themes. And so knowing your audience and knowing, but knowing too that the bottom line tends to be retention to graduation for most of us, or retention to the next semester for many of us, that becomes really, really important data. If you can connect back at the individual level to the registrar data or the financial aid data or to the clearinghouse data, honestly, is another place to get that if we're thinking that large.
And I would also recommend looking and talking to whoever, if your institution does, and I think most do, any kind of post-graduation survey. Upon graduation, most of your students, you may not even know this, upon graduation, they receive a survey from your institution. I've always found it very interesting that folks in student affairs are not involved in that conversation about that survey, since many of their hours of engagement on campus are within student affairs. But finding out who does that survey and what's on the survey and getting those items, and then asking if we can play with that survey a little bit and see if there's some items that you can get on there, because a graduate is a very powerful marketing tool to your institution. And so if you have 90% of your graduates say XYZ, that's a very powerful message. But you got to get a hold of that assessment tool.
And simple data presentation. Sometimes when we're feeling a lot of pressure to tell a really complicated or a really high-stakes story, we pull out the 3D bar charts that have lines and animations, and all that stuff is distracting. People also don't like path diagrams, diagrams of your structural longitudinal cross-lagged. They like bar charts, preferably in some kind of alphabetical order with not a ton of color. Those are the things that seem to work really well. And I see people giggling, but I have made all those mistakes. Yeah.
No more questions? All right. Well, I would like to thank our panelists for participating today.
All right, thanks again. Very much appreciate our panelists today. Just a couple closing remarks. I'm going to free associate for a few minutes, because as I was down in the audience and talking to people, they were saying, remember to remind everybody about this. From the Student Health Insurance Coalition discussions, one of the states that actually has been very forward-thinking in the ships in lieu of Medicaid has been Massachusetts. And just some of their numbers in that state, they've actually had 23,000 students enrolled in that program, and the cost savings to the state was about $25 million. So just putting some metrics around what could be done. Imagine if we could get that in 49 other states. Mary Hoban, our Chief Research Officer, couldn't be here, and so her spirit was here on this panel. But I would be remiss if I didn't talk about a couple different research elements just to keep your eye on. Obviously, the National College Health Assessment. We have the third version of that that's rolling out in the fall of next year. It includes a host of new measures, including resiliency. There will be a component of that in there. The National Faculty and Staff Health Assessment is now out. In fact, I was just talking to, right here, a university that was one of our early pilots, so would encourage you all to do that. The more universities that do it, the better our reference group is. And if I think, as we've said, even what was I was just told, asking your faculty and staff to actually do it was very powerful, right? And showed about really caring about their health and wellness. We also have our Connected College Health Network, which is the large multi-year project that ACHA is involved with for collecting data. Coming to your mailbox soon for ACHA members is something called Institutional Profile. It's the baseline of collecting data between universities, looking at everything from FTE to your health promoting practices. Please, when you get it, fill it out. I think if we get a mass group of folks that start taking this, you'll be able to get data back and compare against other organizations. We will also start collecting data next year from the electronic health record systems in order to start looking at comparative data. So a very exciting, big project, but it's going to take a family to get it done. And so if every university could really chip in and do that, it's great, and you'll what do they say, do well by doing good through the effort. I think, obviously as we look back to, over the last 2 days, we just had kind of a fire hose of information, and it's just been incredible. It's been a great knowledge journey. So I just want to thank again all of our panelists, speakers, and all of our attendees for sitting here or at home or at your office kind of listening to this. Because I think at the end of the day, what we're trying to do is we're all planting seeds, right? We're all germinating these seeds, and I think that's the spirit of, I think as Dr. DeGoya said, the academy, right, is together, is trying to figure out how do we do this and figure out what's working and what's not, and grow these into real solutions on your campus when you go back home. I remember somebody used to tell me that when you go on airplanes, the overhead baggage bins are like, they suck good ideas out, right? So you have all these great ideas, and as you fly back to your real life and you go, and now I have to apply them, and campus life kind of comes back. But today, I think a couple of things you can expect. First, we are going to record this, put it up online. Please share it. Share it with your colleagues, within your institution, across other universities. This is the reason why we offered it for free online, was we wanted to have maximum effect. This isn't just about this room, it's about trying to share knowledge for the greater community. For those of you that were not able to attend, would like to watch again, please, they will be up there online. We have another of initiatives, as I mentioned early on. More will be coming out on those. One of those other ones I haven't mentioned yet is a new website called Healthy Start U. Just a U at the end, which is going to be a new website launched in 2019. It'll be a free resource for universities, kind of all things health and wellness about transitioning into college. And so it's kind of this idea of how do we start compiling the best information that we know for students and parents and university administrators around that. Everything from healthy lifestyles to living with chronic diseases to, yes, student health insurance information. Additionally, I'd encourage you to please take a look at our supporting organizations who we have out there, the number of nonprofit partners that were involved. They do incredible work and have great programming as well, so I'd encourage you to support their work. Finally, to all of you listening over the past 2 days online and here in this room, I just want to thank you for what you do. You cannot possibly get enough thanks from our students, from our communities, and I certainly want to offer ACHA sincerest thanks to all of you for the hard work that you do every day in making the difference in the lives of our college students. I'd urge you to continue your innovation and your hard work, and please share back your results. And I think that's kind of what the whole purpose of these kinds of events are. With that, we'll go ahead and conclude this summit, and I wish everyone safe travels back home. If you are going to hang with us for the 1:30 kickoff start for Healthy Campus, it'll be in this room, and otherwise wish everyone a very safe travels back. So thank you very much.